Good afternoon, Mom and Jay. It's good to see you guys again. How's everything going?
Everything's good, but MJ is still having his hallucinations, and we've given him the medication, and he's still experiencing delusions. And
Okay, okay. Um, that's quite interesting because during MJ and I's individual session, he was actively acting out his hallucinations, and he basically kind of like was like whispering, doing like, certain things, like kind of like what's happening right now, and I tried to refocus him and try to work on some deep breathing exercises to distract him. And
MJ, come sit.
MJ, have a seat, honey. Just have a seat, okay? Um, have you and your husband tried the 7-Eleven deep breathing exercise at home?
Yes, we've been practicing them, but he cannot stay focused enough to do the exercises.
Yeah, that's pretty common. That's what I experienced too doing the exercise with him. But I think if we continue to keep practicing with him, he'll probably get it. Um, so MJ, how's things in school?
Terrible, okay? How can I stop the 56 voices in my head? Can my medication can my medication be decreased?
Um, well, MJ, what will have to happen is the next time we meet with the psychiatrist, what we would do, we would express these, concerns. But in his case, rather, because he's chronically ill, he's on 5 active medications, so to help stabilize his thoughts and his mood. But sometimes it's quite prevalent that he will continue to still have these hallucinations, but it's up to his level of stress or anxiety. So based on like the day treatment team staff and the school staff, we're going to try to create some coping strategies for him. Right now, his teacher informed me that he's allowed to have at least 2 to 3 breaks during each class period. And that's rather if he wants to get a drink of water, go for a walk around the school's campus, or climb a tree. Most of the time, we really don't like for him to climb the tree because it's pretty dangerous. So I wonder, does he do that at home a lot too?
Yeah, he does try and climb onto, trees and
Right,
other
right,
things
right,
too.
right. But I mean, he follows instructions when we tell him to come down, but it's just that it's how often it happens. And another thing that concerns us is that he really likes to stay to himself a lot, and we're trying to kind of like help him to engage and interact with his peers. So, does he have any friends at home? To kind of like pull him out of his shell because he seems to be very far removed.
I mean, we have neighbors with children, but he doesn't try to interact with them or, form friendships.
Okay.
But
Okay. MJ, do you want to have friends?
No.
Why?
Too many voices.
Okay. And now these voices, are they telling you to do certain things?
They told me to hurt myself.
Okay. Hurt yourself how?
Like cutting.
Mom, at home, are the knives anything that's will be considered a weapon in his case to be used? Is it like put away
yeah,
or?
we have them put away so that he cannot harm himself.
Right, right. Because even when he's at school, he has a one-to-one aide that helps monitor his behavior and certain things because he's it's likely that he might try to take something and probably use it to cut himself, and we don't want to have that. But for the most part, he's pretty sweet. He's a decent kid. It's just that we really would like for him to kind of like work on his communication better, because it's kind of hard to understand what's going on with him if he doesn't verbalize it. But his teacher also shared that he's a really good writer. So we kind of suggest to him that he should do some journaling. And I think that should be practiced at home as well. I don't know how often he will be willing to sit still and do that, but for certain occasions, I think it would be best. We also wanted to kind of share with you that myself and his teacher, we kind of decided to use this anxiety screening tool to kind of like measure how often he experiences anxiety. And this is a bi-weekly, so every 2 weeks we kind of go back to it to measure if it's still the same, if it decreased or increased. And in his case, it kind of like remained the same. He's kind of on the far end of moderate to severe anxiety level, and which we decided to do was to kind of give him some time to really like reflect, try to pull like some of these thoughts, these hallucinations that he's having, and kind of like normalize certain situations and try to help him to understand that, you know, it's okay that you're having these thoughts, but it's best not to act on them, you know, because they're not always in the best interest of himself or others. So we were kind of thinking that we would refer him to the Office of Persons with Developmental Disabilities just for additional support, because we kind of feel that we're not really getting to him like the way that we want to, as far as addressing his needs. And, you know, we would want all our kids, all our clients to be the best, you know, and it's just kind of hard working with him sometimes, and we would like to have some additional support. Now,
Okay, but does this mean that he will stop attending Parsons, or?
no, he will continue to attend Parsons. He will still be able to get picked up by the bus at the school, pick him up, everything like that. Up until the office contacts me with any updates, if they have another placement for him or any additional services outside of Parsons that could be used, I will share that with you. But also, on the other side, Parsons might be the only option for him, and which is okay. That's perfectly fine. But we just want to make sure that we kind of like address his needs, you know, as best way as possible. But we're still honored to continue to work with him. But we just want to keep you on board about what decisions we're going to make on the behalf of your child. And if you have any ideas or suggestions you think would be best, please feel free to share that with us, because we just want the best for MJ.
Okay.
Yeah?
Yep.
Okay, Mom. So next week we are scheduled to meet on Wednesday.
Okay.
I look forward to seeing you and MJ. And also throughout the week I often go check on MJ to see how he's doing in class. But there haven't been no real complaints as of yet.
Okay.
So, all right. It's good seeing you guys.